My baby is using me as a pacifier. Ding, ding, ding.
Winner, winner, chicken dinner.
You win the prize, but there's actually not a prize. This kiddo still uses a pacifier, doesn't he? And yeah, he does. You can just give them a little gentle love squeeze. Holy Dinah! Here is how to introduce a pacifier with more success. There's actually quite a large debate on whether pacifiers are like the devil's work or the greatest invention since sliced bread. And it's really easy to find articles and videos that support either side of that argument because it seems like everyone likes to talk about pacifiers. So now I'm going to talk about pacifiers. In my reading, I even found an article, a scientific article, that talked about the benefits of soother use, but also the risks of soother use. And I kind of had to do a double take because they were talking about pacifiers like they're some sort of toxic medication. But when you start reading about it, they start to make sense. And we're going to go through some of those so that you know all about it as well. But it was very clear in all of the articles that I read that we shouldn't actively be discouraging people from using pacifiers with their babies under 6 months of age. So we're going to talk about that, but we're also going to talk about when to introduce a pacifier and how you can introduce a pacifier, what makes a good pacifier. Breaking news.
Breaking news.
It is true that you can introduce a pacifier too soon. And that is because babies, they do cluster feed where they suck and they suck and they suck and they suck, but they're doing this for a reason. And that reason is to drive your milk supply. They're trying to encourage your breast milk to transition from colostrum into mature milk because they need those calories to grow and develop and thrive. But if you're giving your baby a pacifier when they are fussy or they are sucking and sucking and sucking, then you could be actually missing early hunger cues and you're missing giving them those extra calories. But you're also missing that stimulation at the breast because that stimulation from the baby who is sucking and sucking would be given into your breast to help that milk supply, but instead it is now going to be given to a pacifier, so it can actually negatively impact your breast milk supply. Because of this, there's actually 4 criteria that I suggest new parents meet before they introduce a pacifier to their new baby. My name is Tina. I am a certified perinatal nurse and a certified breastfeeding specialist. I love all things breastfeeding. So if you are new here, welcome to the channel. And if it is not your first rodeo, welcome back. Those 4 criteria are: your breast milk should be transitioned. So it should no longer be colostrum. It should be more of a mature milk. So not that yellowy golden color anymore. It should be moving towards that white milk. Your baby should be back to birth weight. Now we know that babies lose weight after birth, usually around 10%, but your baby should be gaining weight and getting back to that birth weight by around 7 to 10 days. And in some cases it might take a little bit longer, around 2 weeks, but they should be back there before you give them a pacifier. Your baby should also be able to latch fairly independently, and that latch should be effective. It should be nice and deep, and they should be able to take that milk out of your breast, and they should be able to take it into their mouth and into their tummies. And lastly, you should be well established in your breastfeeding journey. It should be comfortable for you, and that latch should not be painful. Have you ever heard a new mom say something like, "My baby is using me as a pacifier"? Actually, if you think about it, your baby is using a pacifier as you because they're born with a natural need to suck. It's actually called the sucking reflex, and they use the sucking reflex with their rooting reflex to find the nipple and latch onto the nipple and remove the milk from you and get it into them. It's present from birth all the way up to 6 months, and so a pacifier can actually become a really, really great tool so that that sucking reflex isn't completely taken out on you and your nipples. I did tell you I was going to go into the risks and the benefits of these little beauties, so we're going to get into that now because you have probably heard medical professionals say things like, do not give a baby a pacifier too soon after they are born. But then you see pictures of babies in the NICU, in their isolette, or in their warmer, and they always seem to have a pacifier in their mouth, right? Or you talk to a NICU parent, and if you're a NICU parent, you can comment down below and let us know if this is true, but you talk to them and they're like, yeah, my baby always had a pacifier when they were in the NICU. And that is because we see the greatest benefit with pacifier use with babies that are in the NICU born prematurely. There's a ton of benefits. They include things like pain control with procedures. They're always getting things done to them. And And if they're sucking on a pacifier, it is said that they perceive less pain, which is amazing for our little heroes. Also, they're able to transition quicker from like a tube feed where it goes in their nose or their mouth to a bottle feed, and the length of stay in the hospital is usually less with pacifier use. And overall, they have better performance on a bottle. So a ton of benefits for our NICU babies. Now, when we're talking about our term babies, or babies that are born after 37 weeks, there still are benefits to pacifier use in the age bracket of 0 to 6 months. However, a risk pops up. So we'll first talk about benefits because I personally just prefer good news over bad news. And the first benefit is actually the same as the benefits for the NICU babies, and that is a decrease in those feelings of pain. So I often say to parents, if something is happening in hospital that is uncomfortable or painful for baby, like a vitamin K injection or a heel poke for a metabolic screen, go ahead and latch them at the breast and let them suckle, or even give them a pacifier in those moments and let them suckle, because that sucking is going to decrease how they perceive that pain. But the second benefit, the biggest benefit, is a reduction in the incidence of sudden infant death syndrome, or SIDS. So the American Academy of Pediatrics, they say that if you put your baby to sleep with a pacifier, bedtime, nap time, anytime, it actually has a protective effect for our babies. And even if this falls out of their mouth while they're sleeping, it still will lower the incidence of SIDS. Now, it's also important, though, to not have any clips on the pacifier, to not have it attached to their clothing in any way or attached to like a giant big stuffed animal, because that is a strangulation hazard or a suffocation hazard. But if you want more information on safe sleep guidelines, let me know in the comments. Now, the risk of pacifier use, it starts to outweigh the benefits between around 6 to 10 months of age, and then the scales, they tip even further after the age of 2. And our main risk for these older babies is something called otitis media, which is basically an infection of the middle ear. So the AAP, they say that the pacifier use in these older babies contributes to these middle ear infections in a couple of ways. The first way is that all of those secretions and that saliva from all of that sucking can kind of track its way from the back of the throat into the middle ear. And then the other way is that there's a structure called a eustachian tube, which basically connects the middle ear or the inner ear to your sinus cavities. And that actual structure can be malformed in older kids who are using pacifiers due to dental malformations, which is gonna lead me right into our risks for our older kids. And if you guessed that the major risk of pacifier use for toddlers or kids over the age of 2 is dental issues, ding, ding, ding.
Winner, winner, chicken dinner.
You win the prize, but there's actually not a prize. But if there was a prize, you would win it, because teeth misalignment, like crossbite or overjet or any other kind of bad bite that you can imagine, that is the main risk for pacifier use in older kids. And I can tell you from firsthand experience, it is real awkward when you go to the dentist with your toddler and they look in their mouth and they say to you, "This kiddo still uses a pacifier, doesn't he?" And yeah, he does. We're going to stop talking about my kid and his dental issues, and we're going to go back to talking about younger babies, newer babies, because that's probably why you are here. And we know that these newer babies, they suck for many reasons. They suck to increase your milk supply, they suck for calories, they suck to thrive, but they also do something called non-nutritive sucking, which is basically them sucking on anything that doesn't deliver them milk or formula or calories. So this can be like their hands and fists, it can be a blanket, or it can be a pacifier. And if your baby is putting and expending that energy at sucking on a pacifier, then we should probably make sure that that pacifier has some characteristics that really encourages those feeding muscles in their tongue and their jaw to develop in a way that is going to help them continue to thrive at the breast when they are not sucking on a pacifier. If you've been to the store or you've done a baby registry, by now you know that that aisle is full of so many different options. So how do you know that you're choosing a pacifier that is going to help your baby go from the breast to the pacifier easily and help those feeding muscles and palate to develop appropriately? I have a system for you, so fear not. The first thing I want you to look for at a pacifier is the shape of the tip. It should be a rounded shaped tip. You don't want a big bulbous tip. You don't want a tip that's like flat on one side. You want nice and round. The next thing you look for, if you flip it up this way, is the shape of the slope. You want a nice gradual slope from the tip of the pacifier to the base. You don't want something that's super sharp and drastic. Nice gradual slope. And then you look at that base. You want a nice round base, because this makes it so that your baby's lips can flange out. They can latch onto this pacifier nice and deep all the way to that base, and they can cup their tongue underneath, very similar to how they do on the nipple. And then you also want it to be sort of nice and soft and squishy, because you want it to stretch some and you want baby to latch onto this with ease. So those are the 4 things you can do when you go pacifier shopping. So you went to the store, you picked out a pacifier or like 8 15 pacifiers that you think or hope that your baby is going to take, and now what do you do? Because I've heard a ton of people say to me like, oh, my baby hated the pacifier, or every pacifier I put in their mouth, they just spit it out. And that actually does not surprise me, because we've been talking about babies and their reflexes. They have another reflex called the tongue thrust reflex, which is actually protective for them. It's sort of like if something ends up in their mouth, they will spit it on out. And that is no different if it is a pacifier. If you put that pacifier just in the front of your baby's mouth, chances are they're gonna spit it out. But I bet if you harness the power of their sucking reflex that we talked about earlier, that you would probably have a different experience. So here is how to introduce a pacifier with more success. All right, go time. Step 1, get a baby. Step 2, get a pacifier. And then step 3, you want to just stick your finger right in the middle of the pacifier like that. And of course, this will work if you don't put your finger in the middle, but I don't know, I just find like I have more control over the pacifier this way. So we know from the past that putting this pacifier just in the front of baby's mouth is going to have them spit it out, right? But that's because you're aiming the pacifier at the wrong part of baby's mouth. Instead of introducing the pacifier straight on like this, I would love it if you would try to introduce the pacifier on an angle like this. Aim it towards the roof of baby's mouth, because that is where their sucking reflex is located. And when this pacifier comes in contact with that sucking reflex area, that is when baby's going to start to suck, and that is how you're going to see success. So you're going to have baby all lovey-dovey. You're going to sort of gently just brush their lips, top or bottom or around their mouth. You're trying to elicit their rooting reflex. We are talking a whole lot about reflexes, but that rooting reflex is going to have them open their mouth nice and wide. And when baby opens their mouth nice and wide, you're just going to gently guide that pacifier in on an angle. And once it's in there, you're going to leave your finger in there as they start to suck, because that is going to add just the tiniest bit of pressure to the roof of their mouth to encourage them to suck. And when they first start sucking, it's probably going to be kind of disorganized, a little bit chaotic, but eventually just leave your finger in there. You will notice their sucking pattern becomes more regular, more rhythmic. And at that point, you should be safe to pull your finger out and it should stay in there. But some babies have a little bit more difficult than others with this whole thing. Maybe their muscles are just a little bit underdeveloped. But in that case, while the pacifier is in there, you can just give them a little gentle love squeeze on both sides of their cheeks. Like, just have your hands on their cheeks. That will sort of encourage them to keep that pacifier in. And then with more practice, they'll get the hang of it. They'll get a little bit stronger, and they'll be able to keep that pacifier in their mouth without you needing to hold on to them like this the entire time. But if you are thinking about introducing a pacifier, chances are you may also be thinking about bottle introduction. And I have this video all about bottles, types of bottles, how to introduce it, when to introduce it, pace bottle feeding. So if that's something you need, there it is for you. Give this one a thumbs up if you enjoyed it. Consider subscribing, because I love it when you're here. Be happy, be healthy, be well.